Okay, thank you all for coming here this evening. We certainly appreciate this very much. As you were here the last time, we told you this has been a very fluid situation, and that 15 minutes later from the time we talk to you that it can change. And sometimes it's a day, sometimes it's a little longer. There have been some changes that have come along starting at 7:30 this morning in meetings that we were in with our judges here in Wayne County as we were anticipating what we were going to do in the courts and what I might do. Got a text from the mayor who wanted to know if I had the text from Mr. Kenyon at Reed Hospital, and I said, well, I probably do, but I'll take my phone out of the shoulder and look at it, and did. And we realized that at that time there's some changes that were coming along at Reed that has changed since we had talked the last time. And so from 7:30 on till here at 5:30 today, we've been discussing Wayne County and the health of all the folks in Wayne County and how do we keep the people in Wayne County safe. And so we've worked all day through this with all the parties, with the hospital, with Mayor Snow and myself and the fellow commissioners, Denny Burns and Mary Ann Butters, to work to where we are this evening. To those of you of the media, I did pass out the joint executive order of the Wayne County, Indiana Commissioners and the mayor of the city of Richmond. And if you would look at that, what we will do for the viewing audience, I will read the 5 things on the now, also therefore. I'll skip reading all of the therefores and the whereases that the attorneys have put on one full page for my listening audience, that our viewing audience that you have, and we'll get down to the real nuts and the bolts of what we are trying to tell the folks. And then the mayor will have some comments on there, and then with Reed Hospital, we're going to have several comments from there, of which we'll be iterating again to the folks out there of how all of our concerns is your well-being in this community and how we keep you safe and what it's taking and how serious this particular COVID-19 virus is. And folks are beginning to listen to us, but they've got to listen even more. And we're hoping today with the one major change that we have in here will help out. And as Reed Hospital explains some of the changes that are taking place in Reed, and as we're looking at the possibility of the caseload that they have is increasing within the facility there, and many of the changes that they're making to get ready for this. But let me go through this of what we are looking at. First on here, as I say, we have put this all together on here, and we have 5 different items that are new. Number 3, as we get into that, will be a major change, but let me read this to you. All citizens subject to the jurisdiction of both city and county are directed to cease all non-essential interactions, including but not limited to social gatherings and interactions. And number 2, the mayor hereby declares travel restrictions consistent with that Level 2 declaration heretofore declared by the board, and both the mayor and the board wish to emphasize the need for all city and county residents to abide by the terms of that travel restriction. Both the mayor and the board will be consulting with their respective law enforcement officials relative to stepped up enforcement of travel restrictions. Number 3, all employers within the city and the county are asked to effect a reduction in their usual in-place workforce of at least 30% in order to reduce the transmission rate of COVID-19. The requested reduction shall be deemed to include those employees who have been assigned in-home work or are working primarily on a remote basis away from their usual workplace. Employers are further asked to permit self-guaranteed or quarantine by those in their workforce who are particularly susceptible to COVID-19 due to advanced age and or compromised medical conditions as further defined by the CDC. Employers should also increase the proximity of social distancing among their employees and implement such practices with their patrons and customers. Number 4, the actions of the Wayne County local health officers temporarily closing certain identified businesses within the county are hereby reaffirmed by the mayor and the board, as well as those closures heretofore directed by Governor Eric Holcomb in Executive Order 20-04 dated March 19, 2020. Number 5, both the mayor and the board shall continue to monitor local developments relative to COVID-19 emergency. In addition, more restrictive directives may be forthcoming as the situation so requires. So at this time, I'd like to refer to the mayor for some comments. From the mayor, then we'll go to Reed Hospital and our Public Health Board. Mayor Snow?
Thank you, Commissioner Powell. I just want to make it clear that, the impetus of us putting these further restrictions in place, which we have put into our joint executive order, spells out this is to avoid any debilitating demands placed on our local healthcare delivery system. I want to thank the community at hand for the cooperation so far. Many people have done their part to abide by the restrictions in place, but this is a very serious warning to this community. And we have to take the actions and restrictions in this very seriously. So as Ken pointed out, we want to begin with ceasing all non-essential interaction, including but not limited to social gatherings and social interactions. We're calling on workplaces to reduce their usual in-place workforce by 30%. We've had a lot of questions about that. For example, at our city building, we have sent many people to work remotely. So we are looking at your total usual in-place workforce as it would have been a month ago, and hopefully by the end of this week, then at least 30% of that will be away and working remotely. The reason for that is to increase proximity in all places. Proximity is a big component to reducing the spread of illness, and we're going to talk more about that with our healthcare professionals. So as we increase proximity both in the workplace, this also goes for all businesses. Whether you're using carry-out for food or you're an essential business that's open, please exercise proximity in that place. Also, I want to let you know about what we have done on the city level. Our public transit is still operating, but we ask that citizens only use public transit if absolutely necessary. We have reduced our in-place workforce, but our city department heads, myself, we are in place and working daily, so we are still here for you, and we want you to know the government is intact and still working for you. Sanitary, water, and electric services will not be shut off, and late fees are suspended. And if not essential, our police department services such as background checks, personal protection permits, and report copies have also been suspended. So we want to let you know about the precautions that we have taken so far in order to reduce the spread of illness during this healthcare emergency, but we need the community's cooperation in further restricting social gatherings and close proximity at all locations.
Thank you very much. Mr. Kenyon?
Thank you, Ken. I would also extend my thanks to Commissioner Paust and Mayor Snow. This has been a very rapid series of discussions. They've been extremely responsive and very much on tune with us on the issues of protecting our community. The swift action and support is greatly appreciated. I also want to thank the community at large. They've had some big changes at Reed to deal with and caring for loved ones, and there's been different adaptations in our processes to keep them safe and our patients safe and our staff safe, and we appreciate the patience that everybody's extended to that and support we've gotten from the community as well. As we talked about last time we gathered, this is a 3-month-old virus. There's a lot we don't know about it, but we tend to learn from others before us and watching what's happening on the other side of the world to project things that we need to be doing so I don't repeat mistakes that have happened before. About 2 weeks ago now, the Indiana governor declared a public health emergency. A week ago, the president declared a national emergency. So this really reflects what we're really seeing happening across the country, across the state, to do what we can to mitigate the spread of this disease. Again, as I mentioned last time, we're trying to reduce the surge of critically ill patients. A wave of critically ill patients could easily overrun the capacity of our equipment and resources. which is a risk for any community because there's a limited number. We're not prepared for the magnitude of what we're seeing overseas for critically ill patients. So the action taken today, the declaration, is geared towards slowing down the interactions, reducing the exposures. And the real challenge with this is that people don't know that they are passing this exposure on because it passes before you have symptoms. And that's what makes this so dangerous, because people feel fine and they feel they can be out and doing things, but it's up to 5 days before you have symptoms you're actually infected and could be passing that on to family members and friends alike. So that's the real challenge with this, and I hope we can well communicate that to the community, that these are not things we're doing lightly, that these are actions that are really geared towards the protection of spreading a disease that's very unknown, and we have no real tools to battle it. And at the moment, we're dealing with a shortage of tests, which again, tests to be created for a virus that's 3 months old will be in short supply. And that's part of the whole challenge as well. But those will eventually be coming online with more tools. So that's the extent of my opening.
Would you like to tell the folks what you're doing with your urgent care center?
I will let Misty and Dr. Huth and Dr. Jetmore talk more about that part.
Okay,
Misty,
all right.
would you like to share about that?
Absolutely. So what we are currently doing at the urgent care building is we are dividing that space. So the current urgent care will now transition into a respiratory care clinic. So anybody who is transitioned to that from their primary care physician, they can refer to the respiratory care clinic, so we can screen these patients out without contaminating anyone else in the environment and keeping these individuals out of other physicians' offices. So for urgent care needs that are not respiratory in nature, those will be seen at the 1350 building, just so we can delineate that patient population to help keep everyone safe, patients, staff, and all those included. Dr. Huth, anything you would like to add?
Can you tell 1350 to someone that doesn't know what the number is? What's that building and where is it located?
That's 1350 Chester Boulevard.
Is that the wound center or the other, the what I?
Same parking lot.
Which
It's
one?
immediately, a newer building immediately across
That's
from
from
the
the
old hospital site.
Okay, it's where ENT is and the dermatology building?
Yeah.
Is
Down,
it that
down
one?
the street from there.
Oh,
Right down the
it's-
street.
It's east then.
It's right next to the wound healing building, just immediately south.
Okay. I just want to get them in the right location
Right.
on that.
Absolutely.
And so I know where we are now, but the viewing public may not know where 1350 is.
Sure.
Okay, so it's on the west side of the street?
Yeah.
Okay.
And there
very
is
good.
signage that will help direct you to the appropriate destination.
All
I
right,
think
very
the-
good.
The important thing is that the urgent care will be for non-respiratory urgent issues. So that's not the place to go for people who have respiratory infections and want that evaluated. Those people need to reach out to their doctor, their own doctors, or they need to use our nurse call-in line or use the nurse screening line in the Read Health Now app. And then they'll be directed from there depending on how they risk stratify. And if they are referred to our new respiratory clinic, then what they'll do is they'll go through the testing that we can do on site. It's not COVID testing, but they can get blood counts and some other, they can get an evaluation that's sort of preliminary to determining whether they're a candidate for the actual COVID test. And then they will be given advice as to what they should do next in terms of self-care and really a determination of whether there is enough symptomatology to warrant more thorough evaluation at the emergency department. And as Misty mentioned, this is all about keeping possible COVID patients from admixing with other patient populations and from accidentally exposing our healthcare workers to COVID in that situation. Our folks will be in the appropriate protective equipment. They'll have a process to move through, and most of it will be done outside, actually, under tents.
Okay. Would you talk briefly about the misconception of the fact that younger people cannot get that COVID-19,
Right.
or if they do, it's very light, so they don't need to really worry about it?
Well, it is a fact that younger folks tend to have less severe symptoms. And some people have even very minimal symptoms, yet they're shedding virus. So the risk is that, you know, some people will stop listening when they hear that if I'm 20 or 30, that I'm not going to get very sick. And so they stop listening at that point and kind of go on with their lives as though they have the ordinary cold virus. The problem is that they are potentially spreading this dangerous virus to other people. And in particular, we're concerned about the people at highest risk, the older folks, people with lots of other medical problems. And the typical problems that are the comorbidities, as we call them, that are at highest risk are people with diabetes, lung disease, heart disease. And there are lots of those kinds of folks around. Some have all of those three conditions. Those people are at high risk for complications and risk of death, and that's where the risk of complication death is heavily skewed to the older age groups. However, we are learning that even younger folks in the U.S., starting to look at the U.S. data, even younger folks can get complications and be at risk of death. There are very few deaths under age 20, but there are actually a significant number beginning at age 20. So it's a misnomer to think that if you're in your 20s, if you're a young adult, that you won't get sick or can't get sick or won't get very sick. You certainly can, but it's not the same level of risk as the 70 and above.
Okay.
But I guess I would just say that for me, the way to sum it up is that we all have a responsibility to each other.
Very good.
We have to take care of ourselves, be responsible for ourselves, be accountable for our own actions so that we don't accidentally hurt other people.
Okay. To Dr. Jetmore and Christine, if you could talk about some of the restrictions that we have put in place already and how that is beginning to work for you with not only the funeral homes, but the restaurants and other things and the non-essential businesses that you've talked about.
Well, we in the Public Health Department are grateful to the mayor and to the commissioners for this new restriction, because this is a disease, it's an infectious disease, and it's spread by contact with the virus, either on a frequently touched surface or by having a droplet strike your face from an infected person. So we need to keep 6 feet away from each other. We need to wash our hands so that we're not carrying virus to our face, and we need to avoid commonly touched surfaces. I want to echo what Dr. Hughes said. I think it's younger people tend to be cavalier about this, and we're seeing a different group of people getting ill than they did in China. In China, it was extremely older people, but we're seeing a group of people between the 20s and mid-40s, early 50s who are really in the prime of their life, and they're contracting this disease. But it's important, even if you feel like, well, I'm fine, I'm a healthy 20-year-old, you still, if you become a vector, you're going to be spreading this disease through society. So you not only owe it to yourself to protect your own health, but to protect the health of your fellow citizens. We can't stop this disease. It's in our society, it's going to continue to spread, but we can slow down the spread of this virus by these measures. All of us will have hardships by doing this, but by keeping the hospital, which is a regional hospital, this is a hospital for counties like Franklin County and Union County that have no hospital of their own, so they look to Reed for their health care. There's a finite amount of intensive care unit beds and ventilators. And so we need to do everything we can to keep this resource, this fixed resource, by being overwhelmed by ill people. I think we're facing a bottleneck right now in terms of tests, ventilators, and masks. But we'll get through this, and things will get better. But I search in my mind to find something about the coronavirus that I haven't said already 4 or 5 times. But I just want to end by saying, wash your hands for 20 seconds, stay 6 feet away from others, and avoid frequently touched surfaces.
Thank you very much. I'd like to go back to Dr. Hoos for a second on here. And one of the big questions that we're getting asked a lot of as they watch national television and the president and folks talk about, oh, we're putting online, we're going to have 34 million of this and the large numbers. And so a lot of folks are asking, do we have those supplies here in Richmond, Indiana?
Well, supplies are limited. We have enough for our needs right now in terms of protective supplies for our staff, but we don't see huge numbers of being able to come in. And if we have a large number of patients, much larger number of patients than we have right now, then the rate of use of those supplies is going to go way up, and we'll exhaust those supplies very quickly. So we are looking to being able to access resources made available by the federal government. It's called the Strategic Reserve of Medical Supplies, and some of that was released today. We weren't sure how much we'd get. It turns out we did get some, but it wasn't very much. So it's just a drop in the bucket. Consequently, we have to conserve our supply use as strictly as we can because we don't really know how long this is going to last or how bad it will get. Now, when it comes to a frequent question is about the supply of testing capability, and that continues to be very, very limited. The State Department of Health has the responsibility to do the testing. They're engaging with, I think I heard that Eli Lilly has stepped up to make some testing capability or test running capability possible, but then that's also going to be limited at least for a time. We have 2 issues with testing. A limited supply of test kits. We have exactly 100 available to us, and we don't know when we're going to be able to augment that, and we have to conserve those for the highest risk patients where we need to know to make decisions in their care, and then also to prioritize to make sure that we keep our healthcare workers healthy and on the job. Then the other side of that is the state's ability to run tests is limited, and so they ration that pretty strictly. We frequently have situations where we're uncertain about whether a patient could have COVID, and we ask the state for authority to test, and that is denied because it doesn't meet their criteria. We do have access to a private lab testing capability, but they're very limited and only give us a small supply of testing capability. And we have to actually use a test before they'll give us a replacement test. So when in other areas if supplies were plentiful, we would say send us 2,500 test kits, and they would do that, but we can only get one at a time. And so we have to be very careful how we use those resources right now. Hopefully in the future that will change. I know that the president and the national healthcare authorities, the CDC and so forth, they really want to make testing widely available to everybody. But I'm not sure when that will happen or whether that will be in the near future or not. Consequently, we get lots of questions. Can I be tested? And the reality is we have to reserve that for the sickest of the sick, those who require hospitalization or have to be in the ICU, and we have any question about whether COVID's playing a role. So those are probably the big things. There is interest in medications. There are a couple of medicines that are being proposed as possible direct treatments, but we're really far away from knowing whether those are really capable. And in at least one of the medicines cases, there is a limited supply of that as well. So there are lots of limitations all around us, and so from our point of view, we need to control this problem on the front end, which is we have to minimize the spread of the disease, and that's going to minimize the number of individuals who are sick enough to require evaluation and treatment in the hospital, so that we can move them through the system and not overwhelm our resources. I will say that this week particularly, we've seen a continuous ramp up in people presenting to doctors' offices, to urgent care, to our emergency room, with complaints of respiratory illness. How much of this is COVID is not clear to us. There certainly are other viruses in the community, but I will say that it's a little bit unusual for this late in the winter season to see so much of the respiratory illness. We should be ramping down by now, and we're not doing that. The result is that it's hard to tell up front whether we're dealing with a COVID patient or not, and along the way they can expose other people. We have had COVID patients in our hospital, I think, as everybody knows by now, and we're treating a few at the moment. But we also have a significant number of people that we have pending tests on that we don't have results on, and so they have to be managed as though they're actually COVID patients. And they have to be managed very carefully. Staff have to work in protective equipment. They have to be in areas that don't expose, that other people, that patients with non-COVID problems could potentially be exposed to them. Consequently, we've created 3 containment zones in the organization, an area of the emergency department that is physically cordoned off for evaluation of potential COVID patients. A section of the intensive care unit has physical barriers and a special ventilation system in there to help provide a negative pressure in all the rooms of that area. And then one of the floors in the main tower is also going to be dedicated to recovering COVID patients, or perhaps those less sick. The resource intensity of that is high, and it won't take a lot to overwhelm that, which is why we need everybody to do their part to prevent it getting to that level.
Okay, thank you very much. Christine, if you could bring us up to date on what is happening in our public health department. I know you did get some supplies today, and you might mention that large quantity that we received.
Right, we did. We were notified earlier this morning that the Strategic National Stockpile had been released to Wayne County, and so we staged to pick it up with the forklift and everything ready for our supplies, and we had enough to put in the cab of a truck. So rest easy, everyone. We've got our 2 boxes of gloves. So I can't impress upon the public enough to understand. We're dealing with a highly infectious disease, and we're running into limited resources. So as everyone up here has said, we need to fight this at the front end. And if you feel like you have COVID-19 and you're having the mild symptoms of it, don't worry about being tested. As you've heard, we have about 100 tests in Wayne County right now, and we're going to be testing the most ill. But we're asking the public to treat themselves as if they do have it and isolate themselves, quarantine to their homes, and not go out into the public. Whether you have COVID-19 or influenza A or B or strep throat, stay home. If I've said it once, I've said it a million times in the past month. If you're sick, stay home. Don't wait for someone else to take your temperature. Monitoring yourself daily should be something that we're all doing as we're going through this. Every morning you should take your temperature and see if you're running a temperature. If you're running a temperature and you don't feel good, stay home. Keep this out of the public. The reason why we're having to put these sweeping policies in place where we're limiting movement in the community is to stop the spread of this virus. You really should not have to have the government telling you where you can and can't go. If you're sick, you need to stay home. and limit how much gathering that we're having. And that's why we have to put these things in place, is because we have to slow down the spread of this virus. But yes, we put out a policy yesterday, or a directive yesterday, that closed beauty salons, tanning salons, nail salons, barber shops, and I can't remember the other one that was in there.
You said tattoo.
Beauty shop?
Tattoos. Thank you,
yes,
thank you.
yes.
So that was a directive that we felt was important to get out there, and that was a lot of, because there's very close personal space between that employee and the public, and then they move right into the next one where, again, that very close contact. So those policies were put in place yesterday.
Okay, Dr. Jetmar, I know you've had some discussion with our funeral directors here in town. If you'd like to chat about that, please.
We've asked them to not have funerals, basically. It's just another gathering of people. I know that sounds shocking, not having funerals. The people will be interred, but there will not be a gathering of mourners there. We'll have to mourn later at a memorial service when this passes. But this will help, once again, keep people from gathering and spreading this disease.
All right, thank you. Mr. Kenyon, from my point of view, and I'm sure all the elected officials and other folks up there, I just want to say how thankful we are that we have Reed Hospital in Wayne County in Richmond, Indiana. I know in all the conversation that the mayor and myself have had with you and our staff and working with you during these trying times, you've kept us informed of all the changes, and we've only talked today about a few of the changes that you're making at Reed Hospital. We certainly appreciate that. I know your main concern is keeping people healthy, and I know I've said to several folks since our last news conference that you said if people would just let the food alone, we have over 2 months of distribution in the chain of food. That there is plenty of food out there, but if they want to make a run on something, that the key thing there, you said, and some folks kind of joke about this, but it's very serious. Wash your hands, wash your hands, wash your hands. Don't call your friends to come over and play cards tonight. Don't do that. Stay at home. Wash your hands, wash your homes. As Christine says, if you have a fever or anything this way, don't go to work. And we can't emphasize that enough, and you've heard that again here this evening, how important it is for all of you. And we almost have too many people in this room here this evening that we could be spreading that virus tonight. Always 6 foot, keep away. Use the handshake this way, and if you're going to cough and all these. People say, well, that's just common things, but you'd be amazed at how many folks are not doing that. And as we have said in that last paragraph here, we do not want to put more restrictions on. We need each and every one of you to work with us to save all of us, because Reed Hospital doesn't need 1,000 people rushing in there on one day. As you look at that bell curve on there, we want to keep it down here level so that they can handle the influx of folks that possibly could. As Dr. Huth has said, they've seen an influx this week of folks coming in, and that's the reason for the call. And I think we're doing our best to cover everything that we need to tell to you, which you need to tell to the public out there and to our viewing public on there. And I would ask, do you have anything additional that you would like to add yet of what Reed is doing that we haven't covered here this evening?
Thanks, Ken. I think common sense and repeating the mantra, and if need be, my personal way of managing things I need to remember is put a big sign up in my kitchen to remind me when I come down in the morning, these are the things I need to do. And I think putting signs about washing your hands in places that aren't in your restrooms in your home to remind you to get up and do that from time to time. So I would say just repeating over what was shared tonight about these behaviors will really make a difference. And I would say too, Ken, that things should start to eventually get better. When we have a disaster of a flood in a part of the country. The resources of that state and the federal government descend on that section of the country. And there's a lot of people with hands-on dealing with all the facets of the problem at the same time. This is one that's spread all over the country. And there isn't enough of a concentration of resources. So when Christine says, we've got a few boxes of supplies, that's spread over, for us, 5,000 hospitals. So when you hear the number of 400,000 test kits being released this week, I divide that by 5,000 and I get about 80 test kits per hospital, but not all hospitals are the same size. So eventually the supply chain will get caught up. At Reed, we have state-of-the-art lab equipment. Eventually, our vendor that makes our equipment will have a test kit for this particular disease. We'll be able to give on-the-spot results in 45 minutes, like we do about every other test, and determine right there in that exam room that the person has or doesn't have that particular issue and make a firm diagnosis. But right now, we don't have that. And even the test kits that are out, the sensitivity on these has been reduced. So if you're positive, you're probably positive. If you're negative, you may be negative. And therein lies the irony of all this, is that we're just doing the best we can with the tools we have at the moment. But we do anticipate things will get better. We do anticipate supply chains to improve, do anticipate that we can get through this curve. And everybody has been, again, extremely cooperative in managing this huge change we're all going through in our lives.
After one of our discussions earlier today, and you kind of mentioned it here, that Reed will finally be at a position of where in 45 minutes you'll be able to know once you have clearance. And one of the key things, you might talk about the equipment. I'm sure a lot of our viewers say, well, why don't you order that from your supplier on there? You might talk briefly, or you may want Dr. Huth to talk about the equipment that has to be built for you to be able to do this. That's just not sitting out there right now.
Indeed. Yeah, and that is the challenge here. But I think the specific things that we can do that will fit in, like other types of tests we're running, but I do think there's one big difference. Until we get more of a control on who is ill and who isn't ill, we're going to continue to run a deficit on our personal protective equipment. Right now we're putting masks on everybody coming into the hospital because we don't know their status, and we don't want them to broadcast out their particular opportunity for spreading disease that they're not aware of, and we're not aware of either. So we are using masks at a pace we've never used before, and that goes for every single hospital across the country. So we are taxing the supply chain tremendously at a time of great need.
I've been asked today also if your visitation policy might be restricted even more to keep people out of Reed Hospital.
We continue to look at that. We have still full 24/7 incident command status, and we are adapting to things on a daily basis, and if need be, sooner. So as conditions change, we're going to adapt to them, and we have made at least 3 adaptations to the visitor policy already since this all hit.
Okay, very good. Mayor Snow, any final comments that you might like to make before I go back to our folks here?
Yes, thank you, Commissioner Paust. I do want to begin by thanking our first responders and all of our healthcare workers for the work that they are doing right now. They are on the front lines. They are at the highest rate of exposure, and they're at the very beginning of this, and so I commend them all for the work they are doing. In addition to the directive we've given to citizens to cease social gatherings, we want to just further ask that you pare down your travel and reasons for going out to just, if you're going out for food, if you're going out to go to a pharmacy to get medications, if you're going to work, or a pre-approved medical visit, and really try to limit it to those reasons. This evening you've heard us talk about asking employers to reduce their usual in-place workforce by 30% and to allow for proximity in the workplace. We also ask that those employers monitor the health of the people coming in and out of their building. Take temperatures if you have that ability, and look for any temperature over 99.6 and ask if anybody has any symptoms. We also ask that you really make accommodations for the demographic that we've heard is at the highest risk. If you have people within your organization that are over the age of 60 have a compromised immune system, underlying health conditions, these are the people that should be reporting to you and letting you know that they may need further accommodations. And please make those accommodations available. I know that we're going to take questions from the media here in a few moments, and I do want to take a second to answer one of them preemptively. I believe one of the questions that will come up will be how long will the restrictions that we put in place today, how long will this be in effect? And these will be in place until our healthcare professionals advise us otherwise. But public cooperation plays the #1 role in when we get that advisement. So the more cooperative our workplaces are and our citizens are, then the sooner we will see that advisement from our healthcare professionals to lift the restrictions and the directives that are in place now.
Okay, thank you. Do you have anything final that you would like to say to us this evening?
Sure. I would just like to reiterate what everyone has said and just to let everybody know the importance of self-quarantine, staying home if you're sick, washing your hands, because if we have patients that get to the point where they need ICU care, we have limited resources of nurses, physicians, and individuals who can care for patients at this extent. So please, I'll reiterate what the panel has shared, to stay at home, self-quarantine, and wash your hands. Thank you.
Okay. Dr. Ruth?
I would just like to maybe chime in with gratitude for my colleagues on the Reed medical staff and the nurses at Reed Health. So many people have stepped up to really go above and beyond. I'm working with a group of about 30 very talented doctors in our medical command. Mr. Kenya referred to the fact that we have our emergency management plan activated, and I'm meeting daily with those individuals, and they're working with the other operational teams and done amazing things in the last few days. This respiratory care clinic we described basically went from idea to reality in about 72 hours, which is that's really fast in hospital terms, and a lot of people stepping up to participate in that. But the reality is these individuals who are going to dedicate themselves to that are basically taking a risk on behalf of the community. They're risking exposure. We already have around 100 healthcare workers at Reed who are being monitored for possible exposure, and we can manage that, but we need very much not to have significant numbers of people go down with actual symptoms of the virus. That would be a disaster for the community if those crucial resources weren't available to help serve the patients. So that's probably, in my mind, maybe even perhaps the biggest reason for the community to step up and do their part, because we need to conserve that resource on behalf of everyone.
Okay. Dr. Jabbar?
Yeah, I'd like to say we're all in this together. And we've asked all of you to make a lot of personal sacrifices, and I have to say people are willing to do this. They realize the importance of this, and they're uncomplaining. And I want everyone to know that for 80% of people that do contract this disease, this will be a mild course, and they'll heal up. And finally, I want to say we'll get through this. There will come a day when you will not read or hear about coronavirus except in a historic context. So hang in there, fellow citizens.
Okay. Christine, before I call on you, I wanted to say that not only the city, but the county and Reed Hospital and our public health department are working together on a daily basis, but at the same time, to do even more coordination within the community to make sure we have all the sources that we need together, working together, so that if something changes tomorrow, we're ready to start. So Christine, would you briefly talk about the task force that you've put together, that we've been actually had a couple of phone calls today with this new task force that we're working with also?
Right, and that's part of the pandemic plan that has been put together for the community, but it's been enacted, and it has not only the health department, it has elected officials from all of the communities, it has first responders with the fire department in the police departments. It has our EMA. And I can't thank our EMA directors enough for everything that they've been doing to assist the health department as they kind of are the first line here in this, as far as the public goes. The public health department is the one that's setting all the policies and advising, government officials on what policies should be enacted. And I want to thank you guys for doing what you have done. Over the past few days, there's been very difficult meetings taking places, and gut punch decisions are having to be made, unprecedented. In my 20-plus years in public health, I've never had to think about doing some of the things that we're having to do. And so I want to thank all of the elected officials for some of the tough decisions that you've stood up and made, and for being the leaders in our community. So that's who I want to thank right now.
Anything else?
That's it.
Okay. All right, we're open to any questions that any of you may have, and we'll see if we can get an answer for you. So, Jason?
So you guys have obviously discussed this a lot today to come to these particular restrictions that you're announcing. At what point would you, what would it take to enact further restrictions, I guess, at this point?
Well, I think at this point, yes, we did. As I say, we started at 7:30 this morning, been in it all day here, looking at what we could do, what we couldn't do, and how far did we want to go at this time. I can assure you that Mayor Snow and myself and Mary Ann Butters and Denny Burns, my fellow commissioners, had a lot of discussion today as to how far should we take this currently at this time. And I think all of us do not want to try and take this further and put in more restrictions, and I'm sure what you're talking about is what you hear out at level 3, where we stop all people, which in essence some people call that sheltering. But the governor today, the governor said today that we're not that far along in Indiana. That is happening in other places. That would be the last thing that we want to do. That's why today, as we discussed all of this, we all finally came to an agreement that we would ask all of our industry and our businesses in the community to reduce their staff by 30% and have those folks go home. They can shift them back and forth. But our whole thing, and the doctors have emphasized this and emphasized it to you, the whole thing here is to stop the spread of this. So how do we do it? And so I think what would happen is, if I get that text message from the mayor and from Mr. Kenyon that Reed Hospital has seen such a high spike that we need to do something else. What we want to do is preempt this. We don't want that to call, because very frankly at that point it's too late. And so what we're trying to do now is do everything we can. And it's a thing to get out in the community, and all those, you have to help us. If we can keep that level down, we're all right. If we see we have to make more restrictive changes, that is a tough one of where we would have to go and close businesses in town. We don't want to close factories down. We don't want to close some of those mom and pop stores that are out there. But you have to help us all the way through. And so if we got to that point, I'm sure it'd be another 8-9 hour discussion that we would have, because none of us want to have to go to that point right now. But as we said in the last paragraph there, other restrictive things could come about depending on the situation. Any other questions? Yes. Okay, that's fine.
So in the order, the executive order today, it references potential stepped up enforcement of the current travel restrictions. What are we talking about there?
Well, what we're talking about there is, as we said on the level 2, when we passed that, what we're asking folks to do is essential businesses, only essential travel. If you have to go, let's say you have to go, you don't have anything to eat, so you're going to go through the drive-thru. You can go to the doctor on there. What we're asking our enforcement division to do is to be available out there if you see excess people, or if you see the same person just kind of joy around town on there to stop that individual, we want to arrest that individual, but we say, hey, we got your name, we got your license plate, we want you to go home. And so that's what we're asking those individuals to do. We don't want to do that, and we've all come back, we don't want to use the police, we don't want to use our sheriff's department to have to go out and police that, but we're asking them to be more vigilant of what you see out there, and they know this community of people that are out and about that shouldn't be out there, that try and get those folks to go back home on there. That's what we're looking at this point. Anything else? Jeff?
What would your advice be to some small businesses where people, and I'm thinking specifically restaurants, where people, to be able to produce food, there is no choice but to work in their existing very close quarters?
Well, look, Christine, that's a little more into your bailiwick than it is mine. I can think of several things I would suggest as what they do within that restaurant.
Yeah, it's, you know, and trust me, I get calls all day long wanting me to set policies for businesses and things. They need to look at what they can do to provide that space in between their employees. And if they can't, definitely monitoring the employees' health through this. But like Dr. Jetmore said, and Craig said, you know, you can be non-symptomatic, you know, up to 5 days before you start sewing, and a lot of people are asymptomatic. So providing, you know, that separation, I can't answer how they do it. That's for them to come up with different ways to think outside of the box, and how do we get that physical separation between each other so we can try to keep this stymied in the community. Physical separation is one of the best ways we can do that.
And again, I'll use what Mr. Kenyon has suggested. Just because you're doing the separation like we have here, and you washed your hands this morning, I'm going to tell you, and I may be wrong, guys, you can take me if I'm wrong, wash them 2 or 3 times during the day. Just don't do it in the morning or when you get home at night, because you are processing food and stuff like that. And I always come back, wash your hands, and use bar soap. That's still far better. It's all right if you don't have it to use the alcohol, but the bar soap is actually better and does a better job in making your hands free on that. Anything else, Jeff, you can think of? Yes, sir.
As the influx or surge seems a little more possible or probable, if Reed starts to get overflowed, is there any chance of utilizing space at Fayette Memorial that was kind of recently purchased? Is that a possibility at all if, you know, we start stacking beds in hallways in Richmond, if people can move, possibly Founderville potentially? Or if not, is there anything left at Fayette Memorial that could be useful for the folks here in Richmond?
Dr. Huth? Oh, Misty's going to do that one.
I'll
Okay.
take that. So I think depending on how this evolves, nothing is out of the question for what we could do. We want to make sure that we can provide adequate healthcare services for this community. So if that means looking at the expansion into that area, nothing is off the table at this point. And we are planning for surge. So we have plans in place as to how that would transition, what we would do. So we have a very controlled plan of how we would handle a surge.
What is the plan for the surge?
I think it depends on volume. So we have different phases. We're continuing to work through that at this point. So there are phases of that we will continue to work through based on volume.
Bear in mind also that Fayette now, Reed Hospital has bought the hospital in Fayette County, and so they have a responsibility in Fayette County with the individuals in Fayette County that might equally fill up the facility down there, that there wouldn't be excess room down there for folks out of Wayne County to go down there.
If I could add one thing to that, in the declaration, this is a 4-page declaration by the governor. I couldn't tell you how long the declaration is of the emergency that the president issued. But we're getting constant waivers that are coming in. And the waiver is the ability to step aside of the normal rules and processes and take care of issues. So the process of putting people in non-traditional locations, well, you got to have licensing, you got to have all the other red tape involved before you can actually do it. and they're knocking down a lot of those barriers. So if we needed to take over the space down in Fayette and Connersville, we could do it without having to run through all the checks and red tape and the weeks and months of surveying that takes place to make that space licensed. So that's what's happening here, and I think that's a reflection also of what the commissioners and the mayor have done also is their own version of that. How are they taking care of some of the barriers that might take much longer in a normal circumstance to get done, and using other methods to take care of issues very quickly. So we're pleased that the response at the local level, at the state level, and the national level to be able to react to these emergency issues and volume issues that really exceed normal capacity. So what Misty shared is really, yes, we have options and we're going to use them.
I can also say that the city and the county is working together. We've worked very closely with Chief Purcell on how we work with first responders within the county, and he certainly has a plan in place, and we've been working with him on that. We're making space available that for those first responders and so on, so that they would have a place to go, and we certainly thank him for thinking of that. The county's very happy to work with him on that, so we're working in that capacity, which would take care of quite a few people to be able to do this, especially all the first responders that we have, because we certainly need the police, the sheriff, the fire department, the EMT people, Red Line, and all those folks on there. So we're working closely on that, and thank the chief. So I can't emphasize again how much we're all working together on there. Jeff, you had another question?
Yeah, we're getting a lot of response from people who are asking the same question. They're asking if there's been any specific conversation or directives involving daycare facilities.
I really can't answer daycare on there. Christine, do you have anything, or Dr. Jeff Moore?
Yeah, there's not a lot of directives as far as daycares, and I'm getting those calls as well. And we've reached out to ISDH to have more directives on that. We do see that as an essential service to the community, but we also understand that it's a vector also of a cycle that we can get into. So we are trying to find a better way to give directives to those daycares, but as it is right now at, I don't know what time it is.
6:30.
6:30, I don't have any really strong directives, but I'm expecting those by Monday.
Yes, sir.
Was consideration given to putting stronger restrictions in place to try to shorten the overall length of time we're impacted by this?
Yes, we had about 9 hours of discussion today on that, and so out of all of our discussion on that, we felt at this time that this would be adequate at the stage we are currently at this time. Yes. Yes, sir.
We've got one on Facebook that I want to see, and then I wanted to ask a couple if I could. We had somebody ask, can we get a more specific number of the pending cases that you all are looking at?
Dr. Huth, I'll refer that one to you.
Can I share that?
We may have the HIPAA regulations that we cannot.
Privacy regulations, but it's as long as I'm not asked to get into specifics of patients, their locations, and any specific detail. I think the count today was 39 pending tests. And we had 3 positive, about 4 or 5 definite negatives, and the rest are pending.
Yes.
You talked about first responders. So sitting back here, and everybody's talked about the shortage of personal protective equipment. Can you speak to where our first responders, particularly those working on our ambulances, are?
Yes, our fire EMS chief, Jerry Purcell, has made provisions to make sure that our first responders have adequate PPE equipment so they can continue on the front lines. But it's another reason for the public to take this seriously, because if the surge goes too high, all equipment is always going to be a limited supply. So we have equipment in place now. We have the ability to protect them through the personal protective equipment, but we want to make sure that we flatten the curve so that we can spread that equipment out and keep them safe for the marathon and not just for the sprint.
And as far as the other ambulance services on there, Reed Hospital, of course, is one of our ambulance providers that we have in the county. Red Line and Culberson both have adequate supplies currently at this time for the number of folks that they have on there. But same thing the mayor says, it is, how long is this going to go on, and how long will those supplies last?
If I can throw one more.
Sure.
This would be-
We have plenty of time.
But I think you all want to go home. So.
Well, Eric, to me, I'll stay here all night to answer the questions that the folks have out there, because that's what's important. One, we don't want rumors, and we want to emphasize to them how important, again, it is for them to cooperate with us on this. If they do, we're going to beat this thing, but we can beat it sooner.
You all are obviously getting some great help here in Wayne County, but it's been talked about that Reed Health is a regional hospital. Are you all getting the same type of cooperation from the other counties that feed in? People in Wayne County are seeing you all, hearing you all, and feeling like they're the ones that are being put upon. Can you talk about your conversations with elected officials, health care professionals in the other counties that feed into you, which are obviously helping to grow those numbers?
It's a good question, Eric, and I think that Dr. Jeff Moore and Dr. Huth have had conversations with some of those folks. I'm going to let them respond.
Sure.
Each morning at 8 o'clock, we have a conference call. We're in contact with the health officer in Franklin County, Fayette County, now Union County. We've also made contact with Butler County, Preble County. We haven't hooked up with Randolph County yet, but we've reached out to Henry County. So all of the surrounding counties, and these people, they realize we're all in this together. And obviously, everybody crosses these county lines for various reasons or another. And certainly this virus doesn't recognize county or state lines. It follows us and our paths. But yes, Eric, we're in daily contact with these people, and we're able to trade information back and forth in a pretty timely manner. Do you have anything to add, Tom?
Yeah, I think the level of cooperation and dialogue with the surrounding counties has been really excellent. They're very interested and very grateful for the opportunity to interact. They don't get too many of those opportunities, and Dr. Jetmore mentioned that we've been able to facilitate the exchange of information that if we're just simply relying on the state Department of Health bureaucracy is a very slow-moving process, and the direct conversation has been very helpful. Several of those counties, you may know, are kind of disproportionately affected by COVID, especially given their small size and rural circumstances. And they've been very appreciative of Reed's effort to reach out to them, but also the Wayne County Health Department to help them troubleshoot issues that they have and offer advice. And so they far from trying to pawn any problems off onto Wayne County, they're trying really hard to manage what they can in their communities, and we really appreciate their effort.
Eric, you have anything else? Anybody else that's streaming all this, that you've got something back? Jeff, you got anything else? Okay.
Some people a few people are asking now, and they're not specific, so I'm not sure what they mean. They're asking about churches and help with feeding the hungry.
Maybe I'll flip that to Christine. One of the things that I personally that I can think of on that, this is where neighbors certainly can be very helpful, even though we're telling you not to get together in group, but neighbors certainly, who's in your neighborhood. If you have an older couple that lives in that neighborhood, it would be very nice if you could double check on them to see if they're okay, and doing things this way would be very helpful on that. Christine, I guess I will call on you about church gathering. My response is basically, you probably won't want to have that service unless there's a way you can get everybody 6 to 7 feet apart in there. I look out here, like I said, and we really have too many people in this room here today because we've got a good response coming back in. Christine, what do you think?
We've given the directive that we're following the no more than 10 people in a room, and that's to keep that 6-foot distance between everyone. I've had a lot of calls from different churches, and we've asked them to live stream and look at different ways that we can continue to have the religious part of our lives, continue on. But again, we're looking to them to solve. We're giving policies, and then it's up to individuals and businesses and churches to come up with the way to implement best public health policies that we're putting in place. So how a church does that is up to them. If they have an ability to have a service where everyone is spread out, where people aren't shaking hands, those are things we want people to get out of. And I'll share, I'm Catholic, so I'm very used to shaking hands, and that's what we do in church. But my husband is Baptist, and they hug a lot. And so it comes down to your church, and how do you then do the policies, the best public health policies that we're doing. And then if you're sick, don't go to church. Go ahead and stay home and not go in there, because you're going to infect, like Dr. Jetmore has talked about how infectious this is. You're putting your whole entire community at risk when you go to your church services and different places. If you're not feeling well, if you have that cough, even if you're covering when you're coughing, you're still infectious and could put your whole entire community and your church at risk. So I would look to the churches to put their thinking hats on and come up with ways that they can still meet those policies that we've put in place.
And if I could.
Sure, go right ahead.
As it relates to food, and the person that had that question, that was part of a discussion that we had about what does a total shutdown look like, and you'd have to make provisions for people right now that are at home. We have a lot of kids that are home because school's closed, and school is a source of their main food. So there are supplements right now that people are serving those children at home. They need transportation and access to get to those houses. We also have Meals on Wheels, and people that aren't able to get their own meals for themselves. That has to continue. So we wanted to make sure that in all these discussions leading up to this, that no matter what, we still would not be telling those people you can't go outside, you can't drive. You need access to those different groups.
Is there a number, let's say if folks are not on Meals or Wheel now and they're elderly and would like to add to that, is there a number at Reed, or can they call your main number and you would refer them to the Meal on Wheels folks?
Yes, they could call our switchboard. I don't know the exact number, but they'll get them to the
973-3000. And that's, isn't that it? 983, okay, 983-3000, okay. I was pretty close. Call that number and the switchboard will get you to the right place, okay. Anything else? Jeff, you've been very helpful. Anything else coming in with questions of folks? Okay. Anybody else out there that, any question at all that you can think of? Chief Purcell, you have anything at all that you'd like to bring up? All right, very good. I guess in summarizing here a little bit, I'll look to President Kenyon. Wash your hands. Wash your hands, wash your hands, stay 6 feet apart. And if we have to put on more restrictive items, you certainly will get a call and we'll ask you to come in so we can pass this on to the public. I thank you all for coming. Don't shake hands with anybody leaving. If you want to discuss what we did here, make sure you stay 6 foot apart. Thank you very much for coming.